the first time Nathaniel Ames offered a painkiller to a member of the Kirellian envoy. It nearly caused a diplomatic incident. It happened during the second week of the human-Kirellian integration program, a joint initiative meant to ease cultural and medical exchanges between the two species. Nathaniel, a trauma nurse from Minnesota with a background in battlefield medicine, had been assigned to the alien delegation as part of a rotating Earth-based health support team. He'd seen worse than cracked ribs and open fractures, but he wasn't prepared for how badly things would go with one little pill. The Kirellian in question was named Seiksal, a high-ranking logistics officer with a long, slender frame and skin like mottled glass. He'd slipped on a wet maintenance deck aboard the joint station orbiting Europa and had landed hard on his side. From the way he held his abdomen and moved with jerky, stilted motions, Nathaniel suspected bruised cartilage or something close to a cracked rib. Inside the examination bay, Nathaniel scanned him with a portable ultrasound wand. It was the third time that week he'd had to use it on a Kirellian, and each time the alien body's anatomy threw him off a little. He adjusted the settings and frowned. "Looks like you've got some internal bruising, nothing ruptured," Nathaniel said, pulling off his gloves. "You're lucky, but I'd definitely recommend something to manage the pain so you can sleep tonight." Seiksal tilted his head, his translucent skin catching the overhead lights. "Is this an invasive procedure?" No, just oral medication." "A pill," Nathaniel said, reaching into the medi-kit and pulling out a standard-issue ibuprofen tablet. He held it between his thumb and forefinger. "This is mild, promise." "We use it all the time." Seiksal leaned back, eyes narrowing on the small white tablet as if it were quietly threatening him. "You ingest solid chemicals." "Well, yeah, swallow it with water. It breaks down in the stomach. Pretty standard." "What is the flavor profile?" Nathaniel blinked. "It's bitter, not great, but it works." Seiksal recoiled, his spine arching in a way that made the nearby intern, a young medical student named Henry, drop the clipboard he was holding. "You voluntarily consume substances with bitter signatures. That is the universal biological marker for poison." Nathaniel didn't laugh, though the urge nudged at the edge of his ribs. "Yeah, I know, but human biology's a little weird that way. Our liver handles it, mostly. Mostly, don't worry." "This one's safe." Seiksal's long fingers twitched in the air, then hovered uncertainly over the pill. He didn't touch it. "I will require a full chemical breakdown and assurance of non-lethality across all known Kirellian metabolic pathways. You're not taking it. Humans take it." "It won't work on you. I'll just use a dermal stimulator for you." Nathaniel pulled another device from the kit, waving it slightly. "But I need it. My back's been killing me since I moved those supply crates yesterday." "You consume poison to soothe your injuries. It's not poison to me." Seiksal said nothing. His pupils dilated and constricted rapidly. Later that day, reports of the incident aboard the Europa station had made their way up the diplomatic channels. Word spread quickly among the Kirellian delegation. Whispers of poison swallowers and bitter-blooded began circulating, and Nathaniel found himself the subject of wide-eyed stares in the corridors. The worst of it came during the second medical orientation session. Nathaniel had been asked to give a presentation on first-response Earth medications and protocols for trauma treatment. It was meant to be routine. Instead, it became a lesson in just how fundamentally alien humans could seem. He stood before a semicircle of Kirellian medical officers, each seated stiffly, their bodies held upright by internal fluid chambers that pulsed faintly under their skin. Behind him was a holo display showing a breakdown of analgesics, antibiotics, and antipyretics. "So this here's acetaminophen," Nathaniel said, tapping the diagram. "Used for fever and mild pain. Comes in tablets, capsules, sometimes liquid. Why do all of your medications require oral ingestion?" One of the Kirellians, a junior medic named Elvar, interrupted. "Ingestion bypasses so many regulatory barriers. It is reckless." Nathaniel scratched the back of his head. "It's just how we do things. Our digestive systems are robust. Pills are easy to manufacture, store, and administer." You do not even mask the flavor, sometimes, but not always. Some of the strongest painkillers taste like charred metal and regret. Several of the Kirellians made low, thrumming noises. Elvar leaned forward, blinking rapidly. You are telling us that humans voluntarily consume foul-tasting chemical compounds without guaranteed palatability, and accept the consequence of nausea or organ strain in the pursuit of temporary relief. Yeah, Nathaniel said. I've seen people pop a pill with a mouthful of old coffee and no regrets. The room fell silent. Elvar slowly turned to Siegsal, who was seated at the end of the semicircle. You witnessed this behavior firsthand. I did. He ingested it in front of me, with no hesitation. As though it were food, Nathaniel sighed. Look, I'm not trying to be weird about it. It works. That's what matters. But the bitterness, Elvar insisted. Why not alter the delivery, use dermal patches, inhalants, transdermal absorbers? We have those too, but not everything works that way. And sometimes you don't get a choice. Like in war zones or remote areas, you take what's available. The discussion turned toward emergency field treatments, and Nathaniel shared stories from his time during disaster relief missions. He told them about having to cut pills in half to make supplies last, about crushing tablets into applesauce for children who couldn't swallow, about the time a man with a shattered pelvis begged for anything, and all they had was a single expired morphine tablet. The Kirellians listened, quietly disturbed. When the session ended, Nathaniel stepped out into the hallway and leaned against the wall, stretching his sore shoulders. He wasn't surprised when Siegsal approached. I did not mean to offend, Siegsal said. But your species' tolerance for bitterness contradicts our understanding of biological safety. Believe me, I get it, Nathaniel said. I've gagged on some of those pills myself. But when the pain's worse than the taste, you stop caring. Have there been fatalities from such methods? Sometimes, allergies, overdoses, but we try to regulate it. We're not reckless, just adaptable. Siegsal studied him for a moment, then nodded. You are unlike any life form we have encountered, Nathaniel chuckled. That's usually the opening line to a horror movie. Days later, the incident seemed to have settled down until a cargo accident forced a joint rescue operation between human and Kirellian teams. A bulkhead collapsed during a loading sequence, pinning two workers and dislocating Nathaniel's shoulder when he helped pull one of them out. Back in medical, he gritted his teeth while a robotic servomich reset his arm. Sweat poured down his face. The Kirellian medic assisting Elvar offered him an anesthetic patch adapted for Kirellian use. It won't help me, Nathaniel said. Different skin permeability. I'll just take something orally. He reached into the counter drawer and pulled out a bottle of hydrocodone tablets, dry swallowed one with a grimace. You consume that without water? Elvar asked. Nathaniel nodded, wincing as the pain started to dull. Water takes too long sometimes. Elvar tilted his head. Your pain tolerance is variable, but your willingness to ingest such substances remains constant. Nathaniel closed his eyes and leaned back against the wall. Pain's a funny thing. Sometimes it teaches you. Sometimes it just ruins your day, but if a bitter pill fixes it for a few hours, I'll take it. Elvar said nothing. The report filed after the accident included a note from Elvar, stating, Human pharmacological tolerance borders on biologically reckless, yet appears to be an evolved survival mechanism. Psychological acceptance of bitterness as a medicinal trait may be adaptive, though unsettling. Word of the report spread. Soon, Nathaniel couldn't walk through the joint station without being offered alternative non-bitter Kirellian treatments. He tried some. They didn't work. They either didn't absorb or gave him headaches. He stuck with his pills. And the Kirellians kept watching, especially during emergencies when he would dig into his medkit, chew a chalky tablet, and keep moving through pain the Kirellians would have considered incapacitating. It wasn't pride that kept him going. It was necessity. And as much as the aliens recoiled from his medication, they couldn't deny one thing: it worked. The air inside the Kirellian infirmary had the texture of cold moss, humid and faintly alkaline. Nathaniel stood motionless, watching the translucent fluid inside the wall tanks ripple with low-frequency pulses. just outside the main chamber, a steady trickle of green-tinted condensation dripped from the ceiling panels, puddling near the base of the sanitation unit. It was the third hour of his shift, and already he'd assisted in treating 2 decompression nausea cases and a fungal reaction to synthetic protein rations. Now he was watching an alien vomit. "It's not the pill," Nathaniel said, holding up his gloved hands as if to absolve himself in advance. He ate a full plate of sulfur root mash without processing it first. That stuff expands like insulation foam if it's not hydrated. The patient, a junior logistics runner with a pale carapace and iridescent jaw ridges, let out a gurgling cough and tried to stand. Nathaniel pressed him gently back down onto the horizontal restraint board with one hand. A second Kirellian, wearing the insignia of a nutrition technician, hovered nearby, her appendages twitching with restrained dismay. "You allowed him to ingest unprocessed root." "I didn't serve it to him," Nathaniel said. "I was walking past the mess when he started retching. He thought it was a human delicacy." "But it is adhesive," she hissed. "It is used to bind industrial filters." "So is gelatin," Nathaniel muttered. "But we make candy with it." The technician froze, eyes dilating into wide, refractive discs. "You consume filter adhesives recreationally, not on purpose." She stared at him, then turned and began consulting a floating data slate, muttering to herself in Kirellian clicks and hisses. Nathaniel shifted focus back to the patient, who had stopped gagging but was now blinking rapidly in confusion. He pulled a dermal scanner from his belt and ran it across the being's thoracic crest. "Stomach lining's intact," he said. "Looks like you're just going to be queasy for a while." "I'd suggest a mild anti-nausea." "No," the patient interrupted hoarsely. "No bitter compound," Nathaniel exhaled. "All right, I'll get you a saline drip and one of your species' cooling packs. Just sit tight." He stepped into the adjacent supply chamber. The door ear-eyed shut behind him with a soft hiss. Rows of medical trays lined the walls, most filled with items that resembled decorative coral or flexible reeds, rather than anything he recognized. He found the Kirellian electrolyte solution pale blue and faintly phosphorescent and slotted it into a sterile injector. When he turned around, Elvar was standing in the doorway, arms folded behind his back. "You're becoming a point of fascination," Elvar said. "You mean a walking cautionary tale?" "Not entirely. There is a growing theory that your species' digestive recklessness is a form of controlled insanity, selected for, cultivated." Nathaniel raised an eyebrow. "Controlled insanity." "That's flattering." "We do not mean it as an insult," Elvar said, stepping inside. "We are fascinated by the idea that your species willingly subjects itself to unpleasant chemical experiences for the sake of function. The concept of temporary discomfort as an acceptable trade-off is foreign to us. We prioritize equilibrium. Equilibrium doesn't help much when you've got a shattered ankle and a limited window for evacuation." Elvar tilted his head. "And that is why your methods persist. You tolerate suffering in increments to preserve mobility." "It is a brutal efficiency." Nathaniel looked down at the injector in his hand. "Sometimes it's not a choice. I've seen people chew through expired gauze just to distract themselves. You don't think about what makes sense. You just think about what gets you through the next 10 minutes. Elvar studied him for a long moment, then gestured toward the main room. "There is an upcoming joint demonstration. You are requested to participate." "Demonstration of what?" "Pain management strategies." "Comparative showcase," Nathaniel blinked. "You want me to demonstrate how we deal with pain?" "Yes, you may select your method. It must be non-lethal, and ideally non-dramatic." Nathaniel rubbed his temple. "You want me to hurt myself on purpose, only mildly." A controlled injury. A long silence hung between them. "Is this a prank?" "No, the Biological Research Exchange Committee secured approval this morning." Nathaniel set the injector on a nearby tray and crossed his arms. "You're asking a human to injure himself for science, in front of a room full of aliens who think we're all lunatics because we swallow pills that taste like burnt pennies." "Yes." He stared at the wall for a moment. "You're lucky we're also incredibly bad at saying no to a challenge." 2 days later, the demonstration chamber was packed. Tiered seating banks of Kirellian observers surrounded the central platform, their pale forms arranged in orderly rows. They wore filtration masks to minimize scent contamination, and many held data slates or recording arrays. A few humans from the joint delegation stood off to the side, clearly uncertain whether they were attending a lecture or a sideshow. Nathaniel stood on the platform, a sealed med case at his feet. He wore a short-sleeved uniform and flexed his right arm experimentally. A Kirellian moderator stepped forward, holding a vocal transcriber. Human volunteer Nathaniel Ames will now demonstrate a common earth pain response treatment. The injury will be minor and self-inflicted. The focus is on the management, not the trauma. Nathaniel nodded. All right, folks, here's what you're about to see. I'm going to apply a mild pressure injury using a calibrated tension band. It'll simulate a sprain. Then I'm going to treat it using a standard over-the-counter anti-inflammatory and a cold compress. He reached into the med case and pulled out a rubber resistance band. Wrapping it tightly around his forearm, he winced as the muscles compressed. Pain levels about a 5, maybe 6. Nothing dramatic, just annoying. He held up a small white pill. This is naproxen. It's an NSAID, non-steroidal anti-inflammatory drug, reduces swelling and pain. I'm taking this with a sip of water. He swallowed it. The silence in the hall was absolute. Hundreds of reflective eyes stared at him, unblinking. Nathaniel opened a cold pack with a sharp crack and placed it over his arm. The slight hiss of chemical activation echoed slightly. Within 30 minutes, the pain will reduce. Within an hour, I'll be fully functional. That's our standard protocol for sprains when we don't have access to advanced care. Cheap, fast, and effective. The moderator stepped forward again. No sedation, no localized numbing, no sensory suppression. Nope. Just one pill and a cold pack. The Kirellians murmured, their voices like shifting gravel underwater. One leaned forward. You do not inhibit the pain completely. Not unless it's severe. Pain's useful. It lets us know what's wrong. Another hissed. But you endure it deliberately. For a while, yeah, the moderator turned toward the audience. This concludes the human portion of the demonstration. The Kirellian method will now be presented. A volunteer stepped onto the stage. A long, flexible sensor was attached to his limb. A barely perceptible electric pulse was triggered, causing a small shiver. Immediately, a technician applied a bioresonance patch. The volunteer's breathing slowed. A display showed neural activity dropping to a calm baseline. Nathaniel watched, arms crossed. No pills, one of the humans whispered beside him. No pain either, Nathaniel replied. When the session ended, a small crowd of Kirellian medics approached him. Your pain management lacks elegance, one observed. But it is, rugged, another nodded. We suspect your species has developed these methods out of necessity, not preference. Pretty much, Nathaniel said. We're not proud of it, we just don't always get the luxury of gentleness. That night, as he sat in the station lounge nursing his mildly sore arm, a small package arrived. Inside was a Kirellian-crafted ingestible. It was smooth, colorless, and completely flavorless. A note attached read, experimental, designed for humans, no bitterness. He held it up to the light, then let it drop into his palm. Progress, he muttered. He didn't take it, not yet. The Kirellian hydrotherapy chamber vibrated faintly under Nathaniel's boots as he stepped in, carrying a stainless steel tray stacked with bandage rolls, 2 antiseptic sprays, and a medical scanner with a cracked screen. The overhead lights flickered, not from malfunction but by Kirellian design. Each pulse signaled a sanitation cycle, calibrated to match the rhythm of their circulatory system. Nathaniel never quite adjusted to it. It made him feel like he was standing inside a giant, blinking eyeball. He approached the central table where Elvar waited, his upper limbs folded neatly, lower ones submerged in the pale blue fluid. Slender filaments extended from his joints, absorbing trace minerals from the water. You're sure you want me doing this here? Nathaniel asked. We've got a human-compatible medbay 3 modules over. This chamber is sterile, Elvar replied, and the incident occurred here. It is efficient to treat it at the source. Nathaniel set the tray down and crouched beside the table, examining the gash along Elvar's lower limb. The cut was clean but deep, running along the edge of a sensory node. The Kirellian skin structure had split open like a punctured gel pack, faintly iridescent fluid seeping into the water. "I'm not going to lie, that's going to sting," Nathaniel said, pulling on gloves. "You've got exposed neural tissue. I can clean it, but it's going to feel like someone's rubbing sandpaper across a sunburn." "I have begun sensory suppression," Elva replied. "Proceed." Nathaniel sprayed the wound with a saline rinse and watched as the Kirellian's filaments twitched. The antiseptic foam foamed up in tiny lavender bubbles, which he wiped away with a sterile pad. "You didn't have to come straight back to work," he said, taping a compression strip across the injury. "Protocol says you're allowed 6 hours recovery." "I required a distraction." Nathaniel straightened, peeling off his gloves. "From what exactly?" "From the influx of requests." "What kind of requests?" "Pain tolerance studies, ethical inquiries, cultural assessments." "Since your demonstration, several departments have proposed comparative resilience trials." Nathaniel leaned against the water tank, arms crossed. "They want to poke more humans. They wish to understand the threshold. Your demonstration contradicted several assumptions about your species, including the idea that you avoid sensation. We don't enjoy it, if that's what you mean. The distinction is unclear. You do not reject it, you accommodate it, you even measure it numerically as if it were a game score." Nathaniel snorted. "That's just pain scales, helps with triage. 1 means it's annoying, 10 means you're screaming and possibly on fire." Elver blinked slowly. "You have encountered level 10 more than once." Nathaniel gestured vaguely toward his shoulder. "Rotator cuff tear back in 23, thought I dislocated it again, so I kept working with it. Didn't realize the tendon was halfway gone until I couldn't lift my arm anymore. You continued functioning with a torn muscle. I thought it was just strained. We all do that. You sort of wait until something stops working before you admit it's bad." Elvar dipped his injured limb further into the solution. "This aligns with the hypothesis. You endure because you mistrust absence. Silence in your body is not security, it is uncertainty. So you accept discomfort as confirmation. That might be the most poetic way anyone's ever described stubbornness," Nathaniel said, already loading the used tools into a sterilization pod. Elvar's voice lowered, just slightly. "I did not intend to disrespect your methods. I admire your consistency, but some among us find it disturbing. I've noticed. There is concern that if humans ignore pain, you may also ignore damage, that you may degrade without awareness." Nathaniel hesitated, then pulled one of the antiseptic sprays from the tray and held it up. "See this?" he said. "It smells like bleach and old socks, stings like hell, but we use it because it kills everything that doesn't belong. That's how we operate. We don't filter discomfort out, we use it to make decisions. And if the discomfort cannot be removed, then we adapt. We find ways to live with it. I've treated soldiers who adjusted their gait to compensate for shattered knees. Office workers with permanent wrist damage from years of typing. We don't always fix the problem. Sometimes we just figure out how to keep moving." Elvar's eyes narrowed, not with skepticism but with something closer to calculation. "Would you allow me to replicate one of your treatments?" Nathaniel raised an eyebrow. "You want to try a human medication, a mild one, supervised." "I wish to understand it through experience." Nathaniel stared at him. "You really want to swallow something designed for an entirely different digestive system just to see what it's like, with safeguards. I have acquired a metabolic buffer. It will neutralize any incompatible compounds." "I am not acting recklessly. I didn't say you were. I just didn't expect you to be curious. I have spent cycles studying theoretical resilience. It is time I study practical resilience." Nathaniel opened his medpack and pulled out a travel container of chewable acetaminophen. "These are children's strength. Won't do much, but they're the most benign thing I've got." Elva reached for one, his fingers pausing just above the pale tablet. "It has scent, artificial grape, not dangerous." He took it between 2 fingers and examined it, then placed it on his tongue. There was a pause, then a violent, involuntary shudder ran down his back. His jaw twitched. "It is," Elvar began, then stopped. Nathaniel waited. "It is reminiscent of fermented plasma extract," he said finally. Not unpalatable, but unexpected, Nathaniel laughed. That's the nicest thing anyone's ever said about grape flavoring. Elvar closed his eyes. I feel no effect. You wouldn't. It's not made for your receptors, but you did it, and that's saying something. Elvar opened his eyes again, slowly. I believe I understand now. Your willingness to endure bitterness is not indifference. It is discipline. You measure relief against cost and accept either. That's the job, Nathaniel said, standing. We don't always get to choose how we feel. But we get to choose what we do with it. Several hours later, Nathaniel stood in the human quarters kitchen alcove, watching water boil in a narrow pot. He stirred instant noodles with a fork, the scent of salt and artificial chicken drifting upward. Footsteps approached light, deliberate. Elvar entered, his gait slightly favoring his uninjured side. I survived the ingestion, he said. Nathaniel smiled. Barely. There is a request, Elvar continued. The committee wishes to close the exchange cycle with a shared protocol session, mutual demonstration, no injury. Only methods, Nathaniel nodded slowly, just side-by-side treatment comparisons. Yes, no consumption required. All right, that I can do. That evening in the observation chamber, 2 stations were set up, one for each species. Nathaniel prepared a basic wellness kit: heat pads, electrolyte tablets, adhesive kinesiology tape. Elvar arranged a row of mineral spheres, scent diffusers, and a neural rhythm regulator. They worked in silence, then demonstrated each item's use with minimal commentary. The observers watched. No notes were taken, no questions were asked. At the end, Nathaniel turned to Elvar. Feel like we actually explained anything? No, Elvar said, but we showed that we function. That's enough. For now. Nathaniel packed up his kit and glanced at the crowd filing out. So no more requests to break bones for science. Unlikely. Good, Nathaniel said, because I'm out of naproxen. Elvar tilted his head. I may have a substitute. Nathaniel held up a hand. If it tastes like fermented plasma, I'm passing. They left the chamber together, not quite in sync, but close enough.